We don't refer to the men in our groups here at UBC that we run as prostate cancer survivors, because that reminds them of victim status. We call them, these are groups for men who've had the cancer. So the focus is, this is a group for men who have a prostate cancer, versus you are an injured survivor. Because if you use that term, prostate cancer survivors, the focus isn't on their integrity as a man, but their focus is on what happened to them and the pathological process that's ongoing in their bodies. And that can be anxiety-provoking and threatening to them. And being mindful that we're going to focus on not the deficits they have or the weaknesses or they have initially to build an alliance with them, but we talk about who they are, what are some of their life goals, what are some of the achievements that they've had in life, even though they may be facing a life-threatening illness or a psychological trauma. It doesn't matter what it is, but we don't begin with that by not focusing on what's wrong with them, because that's sometimes perceived as threatening. And then you're going to run into a lot of resistance. Why it works so well in groups is that many males may not think they need help, but they really value helping others. So when you put them in a group, they're there saying, well, I'm here to help the others. And that's fine, because they can help themselves by helping others. They're grieving. They need to be able to grieve about the loss. And I want to say this. Many males' inability to be emotional and grieve is actually a conspiracy in male socialization, because what it does, it inhibits them releasing what's inside them. But in the groups, they do, and they call it just releasing. We don't talk about crying or weeping in groups, because that, for many men, to be seen as crying is, or use the word weeping, they would feel threatened by that. But we say, you just need to release all this baggage. It's called dropping the baggage. Like, you're carrying a ton of baggage. You have this baggage of the terror or the fear. You never got to talk about it. And so what we find is the majority of the group, once it gets established and solid, is they are able to grieve what has been lost and accept what happened to them before they can rebuild. And physicians and urologists and MDs and the oncologists, that's not their job to do that, because they're there for another reason. But what's needed after that is the reconstruction and the confidence of the male, so that they can continue in good treatment and feel good about themselves. The psychosocial adjustment groups are related to not the cancer itself, but how you adjust to what you can't do anymore in your life that you could before, or the threat to your identity, your masculine identity as a man, because of the prostate and its identity with being male.